Hi, my name is James Waldron, and I'm a physician assistant PA for Piedmont Georgia Lung, and I work with your sleep doctors, including Dr. Iatrides and Dr. Schumstein. And I'm here today to just talk a little bit about obstructive sleep apnea and what to expect after your sleep study. So, to kind of just go a brief overview, obstructive sleep apnea, as far as what it is basically the relaxation or partial obstruction of your airway when you sleep at night. So if you can think about your airway, it's almost like a 90-degree turn, right? From your mouth coming in here and your throat this way. So this 90-degree turn is where a lot of the obstruction events occur, and it can be worse if you have increased BMI or body mass index, increased weight, larger neck size, larger tongue size, even a recessed jaw, push back like this. Those can all make the airway smaller and increase your risk for sleep apnea. But basically, sleep apnea can occur at any age, in any size individual, but the higher risk you are portends a greater chance of you actually having the disease. And those obstructive events, either partial obstructive events or full obstructive events, the more often they occur can basically lead to increased blood pressure, increased risk for strokes, increased risk for heart attacks, increased risk for cardiac arrhythmias such as atrial fibrillation, which is very common, among other things. And common other symptoms include fatigue, lethargy, dry mouth, daytime sleepiness, all these type of things. So basically, when you have an obstructive event, what happens is the back of your throat, it starts to, if you think of it like this, it basically starts to get narrower than normal. So your awake, it's wide open like this. If you think of it vertically, you got muscle tone, it's very good. Go to sleep, it starts to relax. When you have a partial obstruction, and even some of that snoring kind of stuff can happen from partial obstructions, which is like the narrowing the airway, but it's not completely cut off. A full obstruction is where the airway completely closes off. Can happen in the more deeper stages of sleep, such as rapid eye movement sleep or REM sleep. And the longer it stays closed like that, the more your oxygen level goes down, the more your heart rate goes up to compensate, and the more at risk you are to have these different things like cardiac arrhythmias and other problems happen during the night. So basically, when they're doing a sleep study, either a home sleep test or an in-lab sleep test, what they're trying to figure out is, do you have these obstructive events? And if so, how prevalent are they, or how frequent are they during the night? So in general, we'll be talking about when I come in the room in a few minutes is what your RDI or your AHI is. RDI, AHI, both terms to basically quantify how many obstructive events you have during the night or during the time that you sleep, during the sleep study. So basically less than 5 events per hour is normal, 5 to 15 events per hour is mild, 15 to 30 events per hour is moderate, and anything above 30 events per hour is severe. We'll also talk about, in general, treatment options for sleep apnea. And the most widely recommended kind of gold standard best therapy there is out there at this time is called PAP therapy, or positive airway pressure therapy, including CPAP, among other PAP therapies. And basically what they do is they blow oxygen, just the minimum amount of oxygen, try to pop your airway open. So instead of it being closed, it actually opens it up, so you can breathe better, normalize oxygen levels, get rid of the heart rate fluctuations, a lot of the interrupted sleep you have during the night, and get a more consolidated deep sleep, more of the REM sleep that actually makes you feel more rested when you wake up. And so that's kind of the best therapy there is. There's also other types of therapy we'll also discuss. But basically, if you have any further questions, we'll go over it in a few minutes and go from there. Thank you.